Hello again. Thank you so much for joining us. Welcome to the UPDWG webinar. This is Gabriella Ailstock. I am going to be your host today from the UPDWG side. Can I just double check that, Susie, everybody can hear me?
Yes, I can hear you.
Okay, great. Thank you so much. Wonderful. Thank you. So thank you all for joining us today. We have a very exciting webinar, and I'm pleased to hand this over to our host, Susie Trogue, who is from VillageReach, who is going to be talking today about the launch of the UAS for Payload Delivery Evidence Generation Toolkit. Susie, if you want to go ahead to the next slide. I do have one quick announcement to make on behalf of UPDWG, and it's a very exciting announcement. We are launching a call for UPDWG steering committee members. And this is a really exciting next step that we're going to be taking as a working group to help the working group become a more neutral and inclusive forum for all of our UPDWG members. I think we're at a really good stage of our growth right now that we would love to have some other members of the working group help with the administration and coordination of the group. And so the purpose of the steering committee is going to be to take responsibility for the advancement and sustained function of the working group. We're looking for current UPDWG members who want to leverage their own experience in the UAV sector to help really foster collaboration and help promote the working group to the rest of the world. It's not going to be a huge time commitment right now. We're probably looking around just having a 1 to 2 hour quarterly planning call and maybe a little bit of interaction with myself and Olivier in between those planning calls. And look out in your inbox probably early next week for some more information and a link to the application. And the application will also be on our website on the front page. So we're very excited about this next step, and we really look forward to having some more leadership with the rest of the group. So I will now turn it over to Susie Trogue from VillageReach, and you can go ahead and get started. I will also say, please hold your questions until the end. We will have a period for discussion. If you want to go ahead and type in your questions to the chat as they're going on, feel free. I will collect those questions, and we'll start with those questions at the discussion time. And now, Susie, over to you.
Thank you so much, Gabo. So as Gabo said, welcome to the September UPDWG webinar. This is a bit of what we'll be talking about today on the webinar. The main topic is about the UAS for Payload Delivery Evidence Generation Toolkit. And first, I'll start by giving you the rationale behind why the toolkit was developed and give a brief overview of the toolkit. Then I'll give a quick orientation to how to use the toolkit. Then Orlando of the Drone Innovation Center will talk about his experience applying the toolkit in the Dominican Republic. And finally, I'll share about a database compiling all drone delivery projects globally before we have some time for discussion. So I'll just quickly introduce myself. My name is Susie Trogue, as Gabo said, and I'm a manager on the Research, Evidence, and Learning team at VillageReach, based in Seattle. I'm also a member of our Drones for Health team, supporting our 3 country programs who are working with governments to evaluate and introduce UAVs for health payload delivery in Malawi, Mozambique, and in the DRC. Some of the photos you'll see in this presentation are from our recent successful demonstration flights, which were conducted in partnership with Swoop Aero, the DRC and Ministry of Health, and Gavi in the DRC. Maybe take a second, Orlando, for you to introduce yourself so others know who you are.
Yes, hi, good morning. Thank you, Susie, for the intro. My name is Orlando Perez. I run the Drone Innovation Center in the Dominican Republic, and basically is the person responsible for the execution of the project that basically generated the center, funded by the Inter-American Development Bank, with basically presenting the use of UAVs and drones as a solution for some situations that we have been encountering in terms of the health system in the Dominican Republic. And I'll just get to that in a couple of minutes when I get my chance. Thank you.
Thanks, Orlando. So as I mentioned, Orlando and I will be presenting today, but this evidence generation toolkit has been really a collaborative effort. So I just wanted to pause at the beginning and acknowledge some of the stakeholders who've provided very valuable input, sample tools, suggestions, in particular the ISG UAV coordinating body, Hitesh and Sarah, as well as the Gates Foundation, David Sarli, and the USAID Center for Innovation and Impact. So let's get into why did we develop the toolkit. So, although UAS present a significant opportunity, as we all know, in low resource environments, progress to date has been a bit slow, or stops and starts with various pilot projects. And so this toolkit aims to provide the resources needed to better generate evidence around what works and what doesn't work, so that governments, investors, and implementers will have the evidence needed to inform future decision-making as well as investment. The toolkit has been in development since January of this year, beginning with stakeholder consultations to compile existing tools and frameworks so that we didn't start from scratch, to generate evidence around the use of UAVs. I used the resources I gathered to draft the logical framework, gathered additional feedback, then drafted the toolkit. This summer, we worked with Orlando and the Drone Innovation Center in the Dominican Republic to further refine the approach and the tools. And to help consolidate the evidence emerging from our sector, Gabo and I have been working together to develop the drone delivery database, which I'll talk a bit about later. So what is in this toolkit? First, the toolkit lays out the phases of introducing UAS into public health supply chains, including criteria to consider when moving between the phases. Then the toolkit presents a logical framework or illustrations of the deliverables and results expected at each phase. We include monitoring and evaluation questions. These questions help to prioritize the evidence to be collected, and then they can be used to reflect on the evidence that was collected. The toolkit includes suggested indicators and data collection methods, as well as sample data collection tools, which can be adapted to fit your project's needs. In the next version, the toolkit will also include case studies of how the toolkit has been applied from now until that next version. And you can see from the illustrations next to each component which pieces are fully complete in the first version of the toolkit, which you should have received yesterday, and those which will be expanded on for the second version. So you can see that those first three are fully available in the first version of the toolkit. And then the indicators, data collection methods, data collection tools are available for the first and second phases, and the case studies will come in the next version. So next I'll go through how to use the toolkit resource. So first, you would determine which phase your use case or operating context is in. On the next slide, I'll give some more details about these three phases. You can see in the illustration on this slide, a screenshot of the actual toolkit, that it's divided by 3 different phases. Then you would look through the resources organized by the phase that you are interested in, so that you can adapt it to your context. As discussed before, these resources include a logical framework, which is an illustration of the desired results, some evaluation questions, some means of measurement, including indicators and suggested data collection methods, and sample data collection tools. Finally, once this data has been collected, the toolkit can help you to share this evidence through the drone delivery database. which again, just a teaser for some more information about that at the end of the presentation. So as I said, the toolkit is divided by phase of implementation, beginning with that first phase, advocacy and testing. This phase is focused on demonstrating the safety of the drone technology in the local context and the feasibility of its use in the local context. During this phase, evidence around the potential benefits and cost of using UAS is collected. A key activity here is a series of demonstration flights over a short period of time, such as a week or a month. In some cases, there may be sufficient evidence that phase 1 of advocacy and feasibility tested has already been completed in your context. For example, much of the evidence needed for phase 1 has already been collected for medical commodity delivery in a context such as Malawi, and new implementers may not need to start from the beginning or repeat data collection activities, but would benefit from existing evidence and coordinating with existing partners. The second phase involves ongoing use and validation of UAS for medical commodity delivery. Evidence here is generated around the effectiveness and efficiency of the system over several months of implementation. The third phase expands impact through scale-up of successful models of operations and focuses on laying out the plan to transition to sustainable operations, which is likely to include both the public and private actors. After each phase, you can see the yield sign there. This indicates that actors should consider key criteria before progressing to the next phase to confirm that sufficient evidence has been collected at each phase to justify moving to the next phase. As an example, you can see here the logical framework for phase 1. Here we illustrate 3 deliverables: permission to import and use UAS, feasibility of introducing UAS based on local acceptability and potential costs and benefits, and demonstration of safe technology in the local context. By the end of this first phase, these deliverables should result in an environment that enables further use of UAS and identification of promising UAS technology and use cases. So this summarizes what we aim to achieve in that first phase. For each of these deliverables, the toolkit presents a few priority indicators. Orlando will go into more detail about each of these when he talks about how we collected data for these indicators in the Dominican Republic. But I just wanted to show that we've put effort into prioritizing kind of the key suggested indicators per phase, and have tried to keep it light and focused on the information that's necessary to inform decisions and investments. The toolkit provides some guidance around how to collect data on these indicators and links to sample data collection tools. So in this example here, you can see that the deliverable is the safe and locally reliable technology is tested. And so you can see each indicator listed, a definition of each indicator, a suggested method, and then the data collection tool, frequency, and how it could be used. The logical framework for phase 2 builds on the results of phase 3. As you can see, the enabling environment developed in phase 1 is strengthened in phase 2, and the potential benefits and costs of UAS identified in phase 1 are further explored and studied in phase 2. By the end of phase 2, ongoing use of UAS is expected to begin to result in improved reliability, coverage, and supply chain performance as a result of the months or repeated deliveries by UAS. Some deliverables are monitored across all phases, although in slightly different ways. An example of this is flight performance, which is a critical component to monitor any time a UAS is used to transport medical commodities. In phase 1, the focus is on what the technology and the use cases can achieve, So indicators measure the maximum distance and payload achieved. Whereas in phases 2 and 3, we are interested in what can be sustained over a longer period of time. So the focus is on sustained flights, average distances, average payloads achieved over that period of time. But you can see that the data collection tools are the same. And so this is meant to help comparability between phases as well. Next, I'd like to turn it over to Orlando of the Drone Innovation Center so that he can talk a bit about his experience applying the toolkit in the Dominican Republic around test flights there this summer. Orlando?
Yes, thank you. Thank you very much. Again, thank you all for participating, and it's a great opportunity for me to basically explain a bit what we've been doing for the last 2.5, almost 3 years, and the achievements that we've had and where we are specifically in terms of next steps. So I just wanted to briefly, if you could please switch to the other slide, basically run out a bit how this all started. Back in 2016, we were privileged to have the opportunity to run a project funded by the Inter-American Development Bank, among other technology partners, basically addressing some specific needs and situations that were occurring in rural communities in the Dominican Republic. So despite recent reforms and advances that the Dominican Republic has had in its healthcare system, there are still poor and low-income people in remote areas of the Dominican Republic that have suboptimal access to healthcare. So the main problem that we intended to tackle was that healthcare needs among these rural populations are not attended in a timely manner, basically due to inefficient health goods and services transportation systems. And one of the solutions that emerged within this conversation was, why don't we establish a network of drones that can basically connect these rural communities to municipal hospitals that do have, at that moment, what we thought was the biggest value proposition was to have lab tests being run in these populations. Again, these rural communities, although they do have an established infrastructure there, or they have the doctors there, the nurses, at the end of the day, they do have to cost their way to go to the bigger cities to do lab testings. And the result is that basically they do not go. It's more an economical or a financial burden on them. So with the support of the Inter-American Development Bank and other partners, specifically later on with Robotics that joined the team at the end of 2017, we were able to basically test different technologies. So that was one of the first hurdles that wanted to pass. Make sure that we were not only testing one or two technologies. So we were able to use in 2017 a first set of flights with Matternet, which we did very successfully, connecting one hospital with 2 rural clinics. Subsequently, at the end of that year in December, we teamed up with Robotics, and which presented a more hands-on open source approach using 2 types of vehicles, basically a hybrid fixed wing that had the capacity of traveling longer distances, and a robust multi-copter as the DJI M600. And we did run a significant amount of flights back and forth back in 2017. Later on, we had another great opportunity, which is basically having funding to make sure that one of the opportunities that we actually find later on was that even if we had successful flights transporting med samples from point A to point B, health officials would say, but the drone is going back empty. Why don't we resupply? And we're like, cool, let's just go ahead and try to do the whole route. So it was another set of data that needed to be collected in terms of humidity, temperature, weight, and see if there was actually value into transporting essential meds to these communities. So again, the problems that we tackled were that some rural communities of the Dominican Republic do not have access to these health products and services. Rural residents have to travel to major cities to get these lab tests. And what happens is that mostly the health workers, they just have this informal system in which they would send either a moped or a motorcycle or a pickup truck to a neighboring city and try to get whatever meds are needed for a specific patient, which is definitely, non-efficient. So this is what we found, and this is what we were able to address properly for the last 2.5 years. Can you please get to the next slide? Yes, thank you. So as part of the indicators, definitely we did get full permissions by the regulator. One of our goals was that not only get the permits, which are quite complex because we do have a quite rigid copy-paste regulation system going on in terms of flight deployments in the Dominican Republic, and has a lot of loopholes, but we were able to get full support by the local regulators. We were flying beyond visual line of sight, which is something that is not even in the wording of the regulations, and we actually got those permits. And I think the important thing here was that they also participated actively during the trial. So they were not supposed to be there. They were not due to be there, but we actually encouraged them to be there. Because at the end of the day, this is a learning process, and we felt very strongly that all partners needed to be involved. So we were able to get full access, full support for these deployments. At the end of the day, if we did not get these permits, there was no project to be delivered. So later on, once we started introducing the use case of using these drones to deliver these commodities and goods, then we started to communicate with our stakeholders and with the community, what was the value around this. So either speaking with health workers, community leaders, security leaders, they all knew what was going on. We made sure that we explained in detail what was actually happening in their communities. And we were very vigilant of what their perception was of the use of technology. We did not collect that data initially in a formal fashion. So later on, once we got the toolkit up in place, we were able to systemize and collect this data in a more formal fashion. Then with the toolkit, we also started to look at the cost drivers to make sure that there is a legit comparison of whatever system was already in place. So, just double checking what types of mechanisms they were using for transportation, either pickups or SUVs. And we started to collect the data on that just to make the comparison at the end of the day of what would be more feasible in terms of the financials. And then we also needed to make sure that the time, the amount of the efficiency of using these units to get either med samples or essential medicines on a timely fashion was actually happening with the use of these drones. And we were able to also tabulate that, put them in Excel sheets, and compare them for further analysis. As far as the third deliverable, basically seeing if it was safe and locally reliable, we did get to register a unique number of flights, making sure that we had all the data of the distances that these units, the different types of vehicles were actually achieving, and making sure that we register the payload. What is the cargo? What is the maximum capacity versus the amount of miles transported with these units? And we were able to yet again make sure that this data was registered and in place for future dissemination. So at the end, we did get I would say, a very successful phase one, because we did get flight permits, as I had indicated a bit back. We did make sure that all of the deliverables in terms of the engagement, cost drivers, and benefits were in place. And then we actually completed, just this last month of July, a total of 157 complete flights within the period of these 4 deployments that we had starting in 2017. The maximum distance of the units were anything between 15 and 16 kilometers. And in average, we were able to transport 2.5 kilograms in cargo, basically essential meds. And when there were samples, they were just a little bit less. So again, with the toolkit, we were able to make sure that all of this data was completely and formally registered for future analysis.
Thanks, Orlando.
Thank you.
And sorry, there we go. So the question becomes, what do we do with all of this evidence? So it's great to generate the evidence for our own programming to tell us what we've achieved. But the real aim here, or an additional aim here rather, is to inform decision-making with multiple stakeholders. So the next steps in the DR would be around leading decision-making with multiple different stakeholders, specifically the government. First, determining if sufficient evidence is available to progress to phase 2, and if that evidence suggests that the results have been achieved, and then should the technology and use cases progress to phase 2. So the results, the key results that are desired in phase 1, if you'll remember from a previous slide, are the development of an enabling environment, which includes regulatory support and government buy-in, and then identification of those promising use cases, which is done through the test flights, using the different technologies that Orlando mentioned, and exploring the different costs and benefits which might come from using UAS. So based on this experience, Orlando and I wanted to share a few key recommendations when applying this toolkit. First, particularly in the first phase, it's important to be flexible with our evidence generation approach, because we're still testing the technology and the use cases. And we all know that using this technology in local context, some of the challenges can be unexpected, and we need to adapt our programming. Similarly, we need to be flexible in our data collection efforts. So the first phase focuses quite a bit on qualitative data collection and flexible tools. The context and the technology really need to complement each other. It's important, secondly, to engage stakeholders at a variety of levels, as Orlando mentioned, at the national, provincial, and local levels, from the beginning of the project, to learn how they would like to see drones used and to help inform community outreach programming, to ensure acceptability of this new technology and to ensure that it actually meets the community's stated needs and their preferences. In addition, it's important to consider how drones fit into the existing supply chain. So Orlando talked a little bit about this, about identifying what use cases and what products to transport and what services to provide were the most locally relevant and where UAS could play a strategic role. So it's great to get the technology to work in the local context, but in order to really integrate UAS into supply chains, those implications and those gaps need to be understood from the beginning. And finally, although cost is an important factor, of course, when considering introducing a new intervention like the use of UAS, it's equally important to consider the potential benefits of the new approach and weigh the relative importance of the different options, the different costs and benefits of each of these options. So finally, before we have a good amount of time for the discussion here at the end, I'd like to discuss how to share the evidence that you and your partners generate about the use of UAS, whether you're using the resources in this toolkit or whether you use your own resources, your own methods. So the drone delivery database is an Excel-based database which lists all of the medical drone delivery implementations globally, not just VillageReach's. We hope that this database will consolidate evidence across projects and promote cross-learning. For example, the database contains contact information for each project and links to source materials and reports when available. Gabo is leading the creation of a new feature on the UPDWG website, which will compile this information into a map, which can be filtered and downloaded in real time. We encourage all of you on this call to consider submitting your project to be included in this database, either by emailing us directly or by filling out a one-page submission form at the end of the toolkit. You can see in the screenshot at the top of this slide that although we have a good number of implementations listed, there's still some gaps in the evidence included in that database, but I think that a good amount of it is known, maybe just hasn't been shared systematically. So as of September 2019, we've compiled more than 40 of these UAS projects globally. You'll note from this visualization that the majority of these projects have been demonstration flights, with only a few implementers at phase 2 and phase 3. As we move forward, we expect to have more evidence to share around phases 2 and 3 as a sector in the coming year. And then we'll continue to build out the toolkit based on those experiences. With that said, I just wanted to, before we get to the discussion, I just wanted to take this opportunity to encourage everyone on this call that if you do want to have your project included in that database, to either contact the UPDWG info email or myself. We also are looking for people to help review or beta test the new feature on the UPDWG website that I mentioned. We're also open to questions, comments about the evidence generation toolkit. And then if you have any projects that you'd like support to apply the toolkit, you can also reach out to those email addresses as well. So with that said, I've left a good amount of time for discussion or questions. I don't know if there are any that anyone would like to share. Otherwise, I have a couple questions for you.
Thank you so much, Susie. This is Gabriella, everyone, from UPDWG. I just want to say this is really great work that VillageReach has been doing this past year and really addressing a need in our community. And one of the main purposes of the UPDWG working group is really to foster this sharing of evidence and this collaboration. So we're really excited about working with VillageReach in order to integrate some of this as more systematically into the UPDWG website and really be the host of this information in the future. So yeah, it looks like we have one question in the chat from Patrick. Oh, no, just a thanks, not a question. But yeah, we can go ahead and open it up to chat if you want to put questions in the chat itself, or you can just go ahead and bring yourself off mute and we can start the discussion.
Yes, this is Smeldy Ramirez from the Dominican Republic as well, from the IDB particularly. I have a question. It's a general question because I got into the meeting a little bit late, and my question is the following: does this tool has is capable of collecting social indicators, let's say in terms of health, or is just a tool to set up a drone network? I mean, a drone network delivery system in terms of health.
Thank you. Let me go back to, there's one slide I want to show you to help respond to your question. Thank you, Smeldy, and it's worth recognizing Smeldy and his support for this project overall. Has been working with Orlando in the recent years here. So certainly the example that we talked about focused on advocacy and testing, and so this is kind of setting up the demonstrations. But in phase 2 and phase 3, we really start to focus on looking at results at the supply chain level. So what is the impact on the supply chain? Is it actually having is the use of UAS actually having the effect on availability, coverage, health worker efficiency that we intend it to? And then depending on the extent of the second phase of the project and the use case and how quickly the results might be seen, you can also start to look at the increased consumption of the products and improved health outcomes. Of course, the use of UAS, we're ultimately trying to achieve improved health outcomes. And so, yes, the toolkit is intended to collect data around these later results and impact as well.
Thank you, Susie and Smeldy. We've got some questions from Patrick here, kind of a two-part question. The first one is, would it make sense to include community engagement in the framework?
Yeah, I think that there's some different ways to kind of be phrasing community engagement, stakeholder engagement. Certainly in all 3 phases, we would be looking at stakeholder and community engagement and have tested some focus group discussion tools and some KII tools, which are included in appendices of the toolkit around exploring acceptability of using drones in the community at phase 1. As you get to phase 2, as I talked about, you know, the types of tools would evolve a bit, especially around stakeholder engagement. You would start to monitor whether communities are satisfied with the use of drones, whether they're observing the types of results that they expected to observe, seeing if there are any unexpected outcomes, especially with something new like this. That would be a very important piece to continue with. And then in addition to stakeholder and community engagement and acceptance and satisfaction, you would also look at local capacity for using and maintaining UAS. So not just acceptance, but also around you know, the capacity to sustain their use in the local context.
Great, thanks. And then in the second part of Patrick's question, so he says that they're working on the code of conduct for cargo drones, and some questions that are coming up are around in terms of benefits. Is it also worth considering benefits around technology transfer, opportunity transfer, creation of new jobs, new businesses, local ownership, things of that sort?
Yeah, I think these are great ideas and very much aligned with some of the deliverables around local capacity. I think this is an area which we can continue to build out the toolkit. I think we would all agree it's a pretty critical component for for sustainability of these approaches into the later phases of implementation. And I think that we do not need to limit the results and the impacts that the use of UAS can have to just, although the supply chain impact is very important, there are other impacts that the use of UAS can have, and some of these might be economic impacts. We would also want to be sure to consider, how the introduction of UAS might affect existing transport mechanisms, and what is the effect that this is having on that type of economy as we move forward in phase 2 and certainly in phase 3.
Great. I'll open it back up for anyone else if you want to come off mute, if you have any questions or comments.
It looks like there's another question, but it says it's coming from Gabriella Alstack, but I think that might not be you.
No, yep, that's not me. So yeah, who amongst stakeholders have typically been the champions?
Yeah, so I think that, because we're working with public health supply chains, our first point of contact is very much the Ministry of Health. And in a lot of countries, it's important to work with the Ministry of Health, not just at the national level, but also at the provincial and the local levels. And then it kind of depends on the use case and on the country context, as far as from a technical public health point of view, which particular department to work with. Another really key stakeholder to start engaging immediately is the Civil Aviation Authority. As Orlando talked about, those permissions are absolutely critical, as we all know, to using UAS in a country. And so engaging them as soon as possible and understanding sort of their perspectives and interests in this process. Some other really key stakeholders, depending on the context, have been, the local leaders or religious leaders, and identifying various community groups that might be active in the community. So I think the main point there is national level stakeholders are important, provincial level stakeholders are important, community level stakeholders are important, and these types of community acceptance studies that are proposed in the toolkit can be really useful in helping to identify the specific stakeholders in each context.
Yeah,
And,
I'm sorry. It's a
go ahead.
Okay, I'm sorry. I just wanted to stress out that one of the lessons that we learned, and fortunately was not a big situation with us, is that we did have a very, very good level of communication with the municipal and provisional and the province level, as well as community leaders. Initially, we had a great contact back and forth with the higher levels of the Ministry of Health and so on. We put that on pause for some time because we were more either dealing with stuff in the field. We did not want to get many people involved in the higher levels. And what occurred was that when we actually went back to actually start to, anticipate and let them know of all the great stuff that was happening, they felt a little bit left out, like, oh yeah, now you're coming back and giving us some more info. So we actually played our cards. Fortunately, it was okay because we did continue to have constant support. But as far as stakeholders, I think it's important to be totally open, transparent, let them be fully informed from day one, and always constant during the process, because again, we played that card just to make sure that we did not have any red lights on the way, meaning that we were not stopped or halted for any particular situation. Again, fortunately, we were able to walk back to them and give them all the results and keep on getting support. But all these stakeholders at all levels must be totally informed and in a timely fashion.
Great, thanks both. And also speaking of stakeholders, so what about the community engagement tools? Maybe you could talk a little bit more about how you developed those tools for collecting the evidence around stakeholder engagement or the community engagement, like focus groups and things of that sort.
Yeah, absolutely. So the community engagement or stakeholder engagement assessment tools, we have some focus groups and KII tools which have been tested in VillageReach's work in Malawi, the DRC, and now in the Dominican Republic. And so these tools are adapted a bit to each use case. So for example, the tools include questions specifically asking different respondents about the use case of interest in each of those contexts to get very specific feedback, and then also kind of more broadly how respondents would like to see drones used. And so the focuses of these tools are looking at any perceived risks of using drones, any perceived benefits that respondents might see to using drones, as well as any suggestions the community might have around, is there a particular time of day when we should avoid using drones? Are there particular days of the week? Any areas, so for example, in the Dominican Republic, there was some concern about near the border area using drones. So these tools have been tested in a couple different countries, and these basic themes have been relevant in each of those contexts, and then that data used to create a community outreach strategy, which is conducted with stakeholders as well.
So Patrick brings up a great question, and I definitely don't think it's off topic, Patrick. He's talking about asking, how do we convince stakeholders that it's more than just the costs that are important for maybe moving on to phase 2 or moving on for phase 3, especially in rural delivery zones where the frequency of delivery might be small or the payload's really small. It might not always be cost effective in the beginning until you can have those economies of scale. And so I actually think, Susie, this is a great point of seeing how the toolkit can help you present other benefits besides just cost for your implementations. So maybe you could speak on that.
Yeah, I can speak briefly on that, and certainly there are likely others on this call who have opinions or experience on this. And I would welcome them to jump in as well. So for me, I think, yeah, there are definitely non-financial benefits, and I think it gets particularly tricky, Patrick, as you mentioned, when thinking about rural areas, but also when you think about if the comparison you're making is to a system that doesn't exist and therefore doesn't cost any money because they're not reaching anyone with a particular product or service, then trying to convince governments or potentially stakeholders to invest is maybe a little bit tricky. I think one way to think about it is looking at how much, there are estimates for a particular health outcome averted, what the financial cost of that is. So there's some ways to look at kind of estimates like that. And there are also, there are ways to talk about, potential for lives saved versus the cost expended. So certainly when thinking about really key health outcomes, that can be convincing. And I think it's about telling that story and making it very clear and concrete. I think this is somewhere where a strong understanding of the supply chain makes a lot of sense, because if you can identify those really strong gaps, or where the key challenges in a supply chain are, where the UAS can really have a significant impact, then it can make the case, that storytelling a bit easier. I think another example that Gabo was talking about is just thinking of different types of benefits and what the particular stakeholder might be interested in. That there's, we've highlighted here transport time saved, but there are other potential benefits. It can ensure product quality when it's transported, for example, with something like biologic samples. If you're carrying these over long, bumpy roads, sometimes the product quality can be compromised in certain contexts, and when flown by drone in a much more quick and controlled environment, this can be a really key benefit in addition to the transport time saved. I'll kind of pause there for a second to see if there were other comments in the chat, or if there's anyone who wants to come off mute and talk about any other ways to address that concern.
Marga, you have some great comments in the chat. Would love if you would come off mute and share those with the others.
Hi, everyone. Can you hear me okay?
Yeah,
yes,
we
I
can
hear you.
Okay, great. Yeah, I think there's, as you mentioned, there are some methods of estimating, sort of lives saved or death or disability averted. I agree with Patrick that it's really important to start thinking about how to quantify those benefits. And our team at FHI has just written a paper, and then we got to the end and we're like, wait a minute, we didn't really quantify this benefit. So we're thinking about this a lot right now. I think Patrick's point about maybe starting a Google Doc to start thinking about this, and I'm happy to share some papers that have done this for other topic areas in case they help others start thinking about how to quantify this. Of course, all this is sort of additional to all the other indicators you're talking about measuring. I mean, I think it's unrealistic to expect that one project could measure all these different things. Nobody's going to give us enough funding to do all that. But I definitely think it's important, and being able to talk to stakeholders about potential economic benefits is very important, and it's a very good sales point, and it speaks to them in their own language. Thanks.
Thanks, Marga. Anybody else have any comments on that topic? And Patrick, I also think it's a great idea for us to start a Google Doc on the different benefits. Okay, feel free to chime in, anybody else, but we've got another question from Tigran. What are the major roadblocks that projects are facing? Regulatory issues, funding, business cases, unpredicted expenses, others. So maybe I'll ask a clarifying question on this. Do you mean what some projects are facing from maybe moving from phase 1 to phase 2, so from a smaller pilot project or a demonstration project onto a longer term implementation? Yep, that's right. So yeah, Susie, do you want to start on that one with some of our research on the database, or do you want me to take that?
Sure, I can give a short answer, and then certainly if you or if others have additional comments and experience on this. I think in your question, you identified what some of the challenges are. I think, the ad hoc nature of regulations in many countries is a bit challenging in terms of expanding the use of UAS quickly. But I think progress is being made there, and there are some models coming out which are useful. I think that designing an optimized drone delivery system with the existing public health supply chain is a key challenge, and identifying really how that system looks. So the operations and financing models and testing those out is a challenge. Is certainly a challenge that takes time to move from phase 1 to phase 2. Now that you've proven that the technology works in the local context, how does the system as a whole work in the local context? And that takes some time to do, and conversations with local stakeholders, and a lot of different considerations and actors to be considered. Someone made a point in the chat earlier about it's not just about those who are very supportive, but also some who may be a little bit more hesitant, or who may pose challenges to the process. I'll stop there and see, Gabo, if you have additional comments to add, or if there are others who have more to add.
Yeah, I think one other comment is just the complex, multidisciplinary nature of these projects. You're working with so many different government agencies, from national security to civil aviation to ministries of health and others, that really that stakeholder coordination is very intense for a project like this. And I think a lot of it takes time and resources in order to align and get some strategic direction that way. But I would love to hear from others as well on this topic, because there's plenty more that have much more experience than me. We've got a comment from Patrick from the cargo drone group that staff costs turned out to be the main cost driver in one of their projects, which made their price per delivery uncompetitive. And then a question for everyone: in everyone's experience, how does staff costs play into your projects and the analysis?
I can also comment on this. I think that I think it's fair to think of staff costs initially being a strong cost driver, but as you transition into later phases, we need to find ways for that not to be the case, or at least for the staff costs needed from outside the country to be greatly reduced. I think that in phase 2 and certainly in phase 3, we'll need to identify sort of local service providers and private sector groups and private sector mechanisms that can sustain this more locally. Maybe that's naive and a bit optimistic, but yeah, I think when we think about cost efficiency, certainly having a lot of staff from outside the country, that it's not going to achieve that in the short term.
Yep, and then there's another comment in the chat from someone that I can't tell who it is, sorry. But they say in early days, it's likely a good idea to absorb some of the staff costs into the research and development until use cases are proven, which unfortunately is probably likely easy for some organizations and maybe not so easy for others. But yeah, staff costs are definitely a big issue that folks are coming up against. Anybody else? Any last comment on that? We've got 1 more minute here. All right, well, I just want to make one final plug for the new drone delivery database that is going to be up and coming very soon. So like Susie said, we've collected over 40 use cases right now and 40 projects, but we still have a lot of gaps to fill within that database. So we will be reaching out to you to help with filling those gaps around the evidence. And then if you would like your information included in the database, please reach out to us. And we're also looking for people to help beta test the database as well. So I just want to give a really warm thank you to Susie and Orlando for all of your work on this toolkit and the webinar itself. It's been really wonderful to get this out there and share with the community. And we look forward to working with you in the future and seeing where all of our evidence leads us. So thank you everyone so much. And yeah, we will see you in the next webinar. Thanks everyone.
Thanks everyone, and thanks to Smeldy from IADB and to Patrick as well from We Robotics. This was a great opportunity to test the toolkit in the Dominican Republic. So thank you.
Thanks to you, Susie, and all the team and all the effort you put to make this happen. So thank you very much.
Have a good day, everyone.
Thanks everyone. Goodbye.
Thank you.
Thank you.